What is the infratemporal fossa? Space between the base of the skull and the ramus of the mandible. What is bruxism? Grinding of the teeth at night. Name the nerves of the pre-division part of the CNV3. 1. Meningeal branch. 2. Nerve to medial pterygoid. 3. Tensor tympani. 4. Tensor valli palatini. Describe the pathway of the pterygopalatine part of the maxillary artery. Passes between the two heads of the lateral pterygoid and enters the pterygomaxillary fossa. What branch of the maxillary artery heads into the mandible? Inferior alveolar. Name the three parts of the maxillary artery. 1. Mandibular. 2. Pterygoid. 3. Pterygopalatine. Name the branches of the pterygopalatine part of the maxillary artery. 1. Posterior superior alveolar. 2. Infraorbital. 3. Anterior superior alveolar. What veins drain into the pterygoid venous plexus? Veins from the orbit, nasal and oral cavities. What does the pterygoid venous plexus surround? Lateral pterygoid muscle. What vein does the pterygoid venous plexus drain into? Maxillary vein. What does the pterygoid venous plexus communicate with? Cavernous sinus and facial vein. What cranial nerve is the greater petrosal nerve related to? Facial nerve, CN7. What cranial nerve is the lesser petrosal nerve related to? Glossopharyngeal nerve, CNX. What does the chorda tympani join? The lingual nerve and heads up towards the tongue. Describe the location of the temporomandibular joint. Between the head of the mandible and the mandibular fossa and the articular tubercle on the squamous part of the temporal bone. What type of joint is the TMJ? Synovial joint. What ligaments help to stabilize the TMJ? 1. Temporomandibular. 2. Stylomandibular. 3. Sphenomandibular. 4. TMJ capsule. What muscle attaches to the TMJ? The lateral tergoid attaches to the articular disc and capsule. What is the anatomical term for chewing? Asynchronous gliding. Which nerves lie in the infratemporal fossa? Mandibular nervechorda tympani-otic ganglion. Which artery lies superficially to the infratemporal fossa? Superficial temporal artery.